Time now for Morning Rounds, our look at the medical news of the week. According to the Centers for Disease Control and Prevention, cigarette smoking takes the lives of more than 480,000 Americans every year. Trying to prevent people from taking up the habit is a key focus in public health.
On Thursday, the Food and Drug Administration said the agency will continue to explore one potential solution, regulating nicotine levels in cigarettes to make them less addictive, though we are a long way from that becoming policy. Joining us from our Washington bureau to discuss this is CBS News medical contributor Dr. David Agus. Doc, good morning.
Morning, Alex. Good morning, Anthony.
So let's talk first about this potential regulation. What are the implications if it actually does become policy?
You always say the word if. So in 2009, the FDA was given authority to control tobacco. And this has been something that's been talked about for several years. That is lowering the nicotine level, which is the addictive component in tobacco. It's been going up over decades. And the idea is if you can lower the nicotine level in tobacco, there'll be less addiction and people will hopefully smoke less. There's actually a study several years ago showing that if you lower nicotine in cigarettes, people smoke fewer cigarettes.
And that was a study in the New England Journal of Medicine, David, I think you're referring to. How significant a reduction do you get?
It's a pretty significant reduction. And so the estimates actually are, in this current issue of New England Journal of Medicine, is that if you lower nicotine in tobacco in about a year, you're going to get 5 million fewer smokers. That's a staggering number.
Wow.
And so if we take away the addictive component, people are going to want to smoke less, especially young people. Once they get hooked in the addictive nicotine, they keep on it. So if we can keep that low, we can have an impact, a big one on public health.
Doc, some people are using e-cigarettes to help them get off regular cigarettes. What does the research say about whether or not that's a good idea?
Well, I think the research says very simply the jury's still out. E-cigarettes are a delivery vehicle for nicotine. Nicotine goes on a carrier molecule which gets it into the lung. The effect of that carrier molecule in the lung really isn't known yet. And so alternatives, I like the concept, but we still need the data to show that e-cigarettes are safe.
Okay, our next topic deals with the financial burden of cancer. It was an issue addressed this week in a new report by the President's Cancer Panel. The focus was on the price of cancer drugs, especially recently developed medications. In part of the panel's public letter to the President, they wrote, "The challenge at hand is complex. Innovative drugs offer new hope for patients to achieve long-term remissions, even cures. But virtually all new cancer drugs enter the market with a price tag that exceeds $100,000 per year." What were some of the key recommendations here, Dr. Agus?
Well, this is a problem, right? Every new cancer drug is $100,000 to $200,000. And so they have a monopoly in a sense. They're the only one to treat a certain stage of a certain disease. And so it's predatory practice. And so this committee said, listen, we have to stop this. It's non-sustainable. Let's figure out a way to price drugs based on value. So the drugs that have few side effects and work really well probably deserve a higher price tag, whereas the ones that cause lots of side effects or don't work as well don't. And let's figure out a value system for the patient and the system where we can have a logical pricing of drugs.
That's really interesting. The report also showed some interesting data when it comes to the launch of new cancer drugs in comparison to income. What exactly did it show?
Well, that was a somewhat depressing figure in the paper, where they had income totally flat, and they had the price of cancer drugs at launch go up like this.
Yeah.
And so when income's not changing, and every year drugs are getting more expensive, you know it's not going to be sustainable going forward. It's not right.
Doc, there is also news about overpayment for prescription drugs. What can you tell us about that?
That's the wildest study coming out of the University of Southern California. What they showed is that, let's say you go to get a medicine for your asthma, and they say their copay is $20. Well, many times, in fact, in the study, 23% of the time, the copay was more than the drug cost on a generic basis. And the pharmacies in the country have a gag order from the pharmaceutical benefit manager that they can't tell you that, listen, if you say I'm going to pay cash, it'll be $7, but paying with insurance, it's $20 because you have that copay. So something is wrong in that system. That gag order makes no sense.
Yeah, it certainly makes no sense. Sounds like some reforms are needed. Dr. David Agus, thank you as always for rising early and giving us the good word on health and medicine.